Good evening everyone, welcome to my YouTube channel. Remember to subscribe, it's me Ode. Today our question of target is on the condition affecting the nervous system, specifically meningitis. Our question is saying Mr. Mbulo, 45 years old, is admitted at Kitwe Teaching Hospital with history of convulsing at home. After the investigations, a diagnosis of meningitis is made. The first one is saying define meningitis. The second one is saying state 5 signs and symptoms that Mr. Mbulo will present with. Then C is detail the management of Mbulo under the following headings. And management. Second, nursing management. Then D is saying state 5 complication of meningitis. E is saying risk 5 preventive measures of meningitis. So meningitis is affecting the nervous system. In the brain, we have what we call meninges. The first, those meninges, there are 3. We have the dura mater, the pia, and arachnoid. The first one is the dura, then the middle one is the arachnoid, and the inner one is the pia. Yes. So the definition for meningitis: this is a medical condition affecting the nervous system where there is inflammation of the meninges found in the brain, and it affects the spinal cord. It can be caused by viruses, fungi, protozoa, or bacteria. And it is clinically manifested by fever, neck stiffness, and loss of consciousness. This is the medical condition affecting the nervous system where there is inflammation of the brain meninges, and it also affects the spinal cord. It can be caused by viruses, fungi, protozoa, or parasites. Yes, or bacteria. And it is clinically manifested by fever, neck stiffness, and loss of consciousness. We move on to the next question. Is saying state 5 signs and symptoms that Mr. Mbulo will present with. So the signs and symptoms, the first one have Kenning sign being positive, which is the inability to strengthen the knee if the hip is flexed. This happens due to nerve irritation. Then the second one is Brzezinski sign also being positive, which is passive neck flexion, which produces the flexion of the knee and the hip. This also happens due to nerve irritation. The other sign and symptom of meningitis or Mr. Mbulo will experience is narcorigidity, also known as neck stiffness. This will be there due to pain. Then the patient will also have mental confusion and lethargy. This will be there due to increased intracranial pressure, which causes brain herniation. Then there will be seizures due to inflammation in the brain. There will be also severe headache due to bacterial toxins and also increased ICP. Then there will be also nausea and vomiting due to increased ICP, which stimulates the vomiting center. So those are some of the signs and symptoms of meningitis. On C, it's saying discuss in detail the management of Mr. Mbulo under the following headings. So medical management. So medical management, all you have to know is to light on the investigation and the treatment. So on the investigation, you can write about lumbar puncture. So lumbar puncture, the CSF will appear cloudy. Yes. Then you can also do blood culture to isolate the causative organism. Then you can also do chest X-ray, which may review pneumonitis or lung abscess. You can also do the CT scan to review hematoma. Then you can also do physical examination, since the patient will also have photophobia, to see if the pupil may be unequal or dilated. Then you can also do check over the level of consciousness using the Glasgow Coma scale. Yes, those are some of the investigation you can do. So on the treatment, the patient has pain and has also fever. So one of the drugs we can give is analgesia. Analgesia for pain and also for fever. So an example for analgesia, we can give paracetam. Paracetam, the dose for male, the current research update is saying for male it is 1 gram. Then the female adult it's 500 milligrams. Presentation of this paracetam is it comes in 500 milligrams tablets and also 250 milligrams tablets. Then the side effects, there will be nausea, vomiting, and also hypersensitive reaction. Then mode of action of this paracetam, it will inhibit the growth of prostaglandins. Then the contraindication, it is contraindicated in patients with renal failure and also hepatic failure. Then nursing implication, you need to give with caution in patients with renal failure and also with hepatic failure. The other medication, you can give antibiotics such as chloramphenicol 500 milligrams IV QID for 7 days. You can give gentamicin 8 milligrams TDS for 7 to 14 days also. You can give sedatives such as diazepam 5 to 10 milligrams IV per oral. It is given as a start dose or every time after a convulsion to prevent further convulsion. In our scenario, Mr. Mbulo has a convulsion, so this medication should be cardinal. Then the other medication you can give is steroids such as dexamethasone to relieve inflammation of the meninges. Yes. Then that's all for the medical management. Then on the nursing management, you just have to use the also known as eplophenema, the eplophenema. The only thing you have to include is the first thing before you even talk about the environment is isolation to prevent close infection and also to restrict visitors. Then the other thing you have to talk about is management of fever, ways of managing fever. So among those ways, you can undress the patient, you can do tip with sponging, and also administer antipyretics. Then on D, it is saying stage 5 complication of meningitis. So one of the complications is hydrocephalus.